Hello, Abington, and welcome to the Health Department Roundtable. I'm chair of the Abington Board of Health, Chris Schultz, and with me tonight is our health director, Marty Golightly, and our Lindsay. I'm going to screw up your title. You are our public health nurse.
I am.
Lindsay Wright. So we thought we would throw together an update, keep people informed on what's going on with the health department. Right now, everybody's biggest concern is obviously the ongoing pandemic and where we are as a town. So do we know where we are today as far as numbers?
We do. So we have right now 183 active cases. And I have to move the screen. 1,188 total cases.
Statewide, there are 7,635 cases reported today, as of 1,700, bringing us to a little over 400,000 since we started tracking in March.
I know for a lot of people, there's been some confusion about numbers being reported because the state reports different figures than the town has. So just for clarification purposes, if I'm understanding correctly, the numbers that we report are current active cases in Abington.
Yeah, literally up to the minute. Lindsay has an Excel spreadsheet that we update as the case comes in. We look at that number, and that is the number that we report on our website. And the state has a significant lag time of as much as 2 weeks. Lindsay, I'm right on that, right?
Yeah, the other part of it is when you look at the state dashboard, that big number, that's been up in the thousands daily, that is confirmed cases. That is PCR or molecular cases. That does not include the antigen cases that are run that we treat the same way. We do encourage all antigen tests to get confirmed with a PCR or molecular test. But until proven otherwise, we report everything, both antigen and PCR and molecular tests, which is why there could be also a discrepancy, because that big number on the state dashboard is only the confirmed cases.
And that's why we encourage everybody to use our website for the town's numbers, because it is literally updated to the minute when we update it. I will use the time on right after the numbers, and it's important for us to give you those daily totals so you kind of have an idea of exactly what's out in the neighborhood.
And as a reminder to people, the health department's page is on the Abington Town website, which is, I think it's abingtonmass.gov.
abingtonma.gov, and the message from the Board of Health is the banner link. So if you just click on that, it'll take you right to that page. Now, it's dated for March 16th, but it's updated at least every day, sometimes twice a day. And if I can, it will be, maybe even, if things are going well that day, I might get to skip a day of updating that if nothing's really changed. And that has not happened in a while.
No, it has not.
And in addition to the active cases, we've been keeping a running total of people in quarantine.
Yeah, that's also a moving target because the CTC doesn't always report immediately how many people that they have in quarantine based on their positive tracks, because we've had to ask the CTC to give us significant hours of help because, well, Lindsay can't keep up with the 180 cases in contact tracing. That's a lot of people to contact. So we had to ask for help. And we had to ask for help additionally because not only do we need the help, but we're also moving into, like with the schools, we're doing a lot of work to keep our students safe. So we work with the school nurses. And now that we're going to start giving vaccinations, we don't really have a choice to send those cases to the CTC. So that we don't always get the exact number of people who have been quarantined up, right up to date as we do with the cases. Like we'll have the positive cases will be 100% accurate, but there may be a little bit of a wiggle room on either end for our quarantines.
Right now, it's 173 in quarantine. I expect that number to change and go up. I'm waiting on, like Marty said, the CTC report. And so hopefully I requested it again, an updated one. So hopefully either tonight or tomorrow morning, I'll have a better, more accurate number. But that changes as people are testing positive. If they're household contacts, we're seeing huge spread in the household. And so, as fast as we're putting 3 or 4 people into quarantine, we're taking them off and moving them into the active case list right now.
And I think it's important for people to understand exactly how much work is involved for you guys when it comes to contact tracing and keeping tabs on people who are close contacts. Lindsay, could you kind of walk us through what happens when you're informed of a positive case as far as contact tracing?
Yep. So I get an email. If the case has not previously been tested, it generates an email to us. If they have been previously tested, it just shows up in an electronic workflow. From that, I take all the demographics down. I actually have the sheet right next to me. So this is all of our questions that we ask the case themselves. And then
she has that sheet because I make her work from home too.
And then, so I take and fill out this sheet, which talks about, who, the what, and how they were exposed to other people. When we ask these questions, I ask a lot of very direct questions to try to jog people's memory. If they were symptomatic a week and a half ago, it's sometimes hard to remember, a week and a half plus 2 days back where they were. We talk about, where they work, who they work with, who they were around. I ask very specific questions about, as one of the tools to help keep our first responders safe, had they had any interaction with EMS, be it, were they pulled over by the police, or had they been transported by via 911. We ask the questions about, for every case, had they been out to eat at a restaurant, if they were not identified as a close contact by me, or if their infectious period goes back beyond a time when they were identified as a close contact, which happens. Each person I'm on the phone with, it's about 25 minutes, I would say, per case. And then every contact
significantly longer, just for the record.
Yeah, Marty sits
is 20 to 25 minutes. Some of them where, there's a long, complicated history, or there's significant numbers of contacts, or they may have, had a significant amount of events they went to. It can take quite some time.
Yeah,
it only takes 20 minutes per contact. It really is case dependent. And I'd say 20, if she's on the phone with a case for 20 minutes, I'm happy.
So that's just talking to the case, and that's, you're kind of, not that any case is straightforward, but we have your case, household contacts, and then limited additional contacts. And then I call everyone that gets put on this sheet. I make a phone call and provide them all of the quarantine information. It got a little bit complicated when they changed it from 14 days and they went to 10 days. Now they've changed it again and we're at 7 days with a test. And so it's there's a lot of nuances. So every case and contact that I speak to gets a very specific email related to them, and when they can expect to exit isolation and when they can expect to need to be tested if they're a contact. And so it is very labor intensive to just keep everyone in a row. And so for every case we have, even if I'm not following them, I fill out a form like this so I can keep track. And if anyone calls, I can easily find the information about them and answer any questions related to their COVID either diagnosis or their close contact status.
That's an incredible amount of work. The one question I have for you, so the Board of Health maintains a Facebook page, and on Christmas Eve, I received a message from somebody who had literally just gotten their positive test, and they hadn't gotten contacted yet. So I knew they were going to get a phone call from one of you soon, but they were kind of in a spot where they didn't know what to do. If somebody receives that positive test, what can they do before they hear from you to help you do your job better?
First
Start
off,
isolating.
first of all, I want to say, stay home, but if you get a positive case and you call the office, one of us is going to talk to you, right? So like, don't feel like I have to wait for them to go. A lot of times, which happened, Lindsay, I think it happened twice today. We'll get, hey, I tested positive, and then we don't have the Maven case ID number yet, or we have not been notified of the positive case. So we can kind of start, well, I don't want to say early, but yeah, early is kind of the right, because there can be a significant lag time between the test resulting as positive to wherever they got that from and the Maven labs reporting it to us. So one, be patient. Two, isolate away from your family as much as physically possible and away from everybody else, and wait to be contacted, or call us and we'll start the process as soon as humanly possible. And yeah, that's pretty much it.
So the other big question on people's mind, and we're going to try to do this weekly for people, so I want to keep our time short here. The other big question on people's mind is vaccines.
Can't happen fast enough. Let's go.
Right. I think the governor had said that they were preparing for first responders. So in Abington, is that what we're expecting within the next week?
Yes, sir.
We are. Can't wait.
Oh my God,
cannot wait.
So just let's talking about the vaccine. So we will be giving it to first responders as early as next week. We've already set up our clinics. We've already set. We were just, I don't want to say lucky, because it was a tremendous amount of work to get set up, but we were set up to receive vaccine, to account for vaccine, to have billing as far back as conservatively August, probably even sometime in July. So we did all of our emergency dispensing site work ahead of time. So we've been ready to go for a while, and we are currently ready to go. Now we just have to kind of, we have to walk through this with the state as they give us vaccine and for us to give out to our first responders. But the first responders will start to get their shots next week. And we are very excited to start doing that to help protect our first responders. And, maybe it signals trending towards some type of return to normalcy. And that's kind of the goal. So right now we scheduled the first responder clinics through our system that we hope will be able to, expand to our general population. And I want to thank all of the healthcare providers that have called us to let us know that, they're out there and, they do COVID facing work. And when we can, we will include them under our umbrella for vaccine. And I encourage the, small medical offices to give us a call to let us know that, that they're interested in those things. But it's a very exciting process. Phase 1, first responders, COVID health, we're ready to go. Now we just have to get our hands on as much vaccine as we can to start the delivery process. And I want to say thank you to the school nurses too, who have volunteered to help us give shots. And a big shout out to the EMS director, Justin Silva, and his crew of paramedics who will also be helping deliver the vaccine, meaning give the shots, and help us with that 15-minute to 30-minute
monitoring window.
Observation time. They got to hang out with us for, to make sure that there are no anaphylaxis or, allergic reaction issues. So, this is a team effort, and I think from the jump, Abington Fire, Abington Police, and us have had a very positive partnership, and it has made the putting together all of these things, well, it's made it easier because I know if I call those guys, we're going to be able to work together. And then local communities too. We're working with a lot of other communities and helping them. I don't want to say helping them, but we're assisting them. We're giving them we're helping them get vaccine to, their guys too. And we will as much as humanly possible.
Excellent. And then to reassure our viewers and our residents, when we are prepared to move to the next phase. The health department will be getting that information out to people, through all of our various channels. So
please sign up for our constant contact. I keep reiterating that when everyone calls asking questions. That's going to be a huge help for us to get information out about clinics that will eventually be coming when we get the AOK, to start rolling it out as fast as we can do it.
And the link for the constant contact is on the health department page on the town website, correct?
Yep. And I know there's been a few Facebook posts that have the link in it. And Peter Schaefer, the superintendent, sent a link to it out via his constant contact. So you might be able to find it in there too.
Excellent. Well, Marty and Lindsay, I want to thank you for joining me tonight. We'll be back next week. I want to encourage people, if you have questions, the best place to get your information is directly from the health department. So please don't be shy about calling these guys. Marty and Lindsay are great and very friendly. And the number there is 781-982-2119.
And if you have questions for next week's roundtable, please just send them through the email contact, Chris Schultz, the Abington Health Department.
Yeah, when you go to the health department page, the Board of Health members are listed. You can click right on my name, and that'll take in the contact form. I'll be happy to address your questions. So thank you again, and thank you to Abington Camp for hosting us. Stay safe, wear a mask, wash your hands, and we'll see you next week.
Thank you, everybody.
Thank you.